Hello everyone, my name is Giovanna Perez, and in this video I will be using the language of anatomy. First I will be pointing out the different body regions and anatomical terminology. Then I will be using directional terms. And then lastly I will be showing the abdominopelvic regions and what are contained in each of the 9 regions. So let's begin. First would be the hallux, which is the toe. Then the axillary, which is the armpit. Buccal, which is the cheeks. Pollex is the thumb. Patellar is the knee. Oral would be here, oral. Mental would be the chin in this area. Brachial would be this, the upper arm. Antebrachial would be the lower arm. Crural would be the leg, this here. Umbilical would be the navel here in this region. Femoral would be the upper leg or the thigh. Calcaneal would be the heel, this here. Sural would be the calf, which would be behind the leg. Popliteal would be the back of the knee, also behind the patellar. Olecranon would be the elbow, so that would be here. Acromial would be the shoulder, here. And occipital would be in the back of the skeletal top. Directional terms, so the head is superior to the sternum, which means the head is above the sternum. The olecranon is distal to the acromion, so the elbow is further away than from the shoulder than the point of origin. The axilla is proximal to the brachium, which means the armpit is closest to the upper arm. The nose is medial to the eyes, which is, it is in the center, towards the center, medial, so the eye is on either side. The elbow is proximal to the carpus, which is the wrist, so the elbow is closer to the wrist. The sternum is anterior to the vertebral column, which is in the back, so the sternum is in front of or before the column, which is in the back. The umbilicus, which would be here, is inferior to the sternum, which means it's lower than the sternum, so the umbilicus is lower. The patella is proximal to the tarsus, so the patella is closest to the tarsus, which is the ankle. And the ears, which would be here, are lateral to the nose, so one on the right, one on the left. That's what lateral. Lastly, the abdominal pelvic regions. So as you can see, I've divided them into 9 regions. First, the right hypochondriac. In this region you'd be able to find the liver and the gallbladder. The epigastric would be here. You would be able to find the stomach and the liver. Here would be the left hypochondriac. In this area you'd be able to find the diaphragm and the spleen here. Here you have the right lumbar, In this area, you would see the ascending colon and part of the large intestine. And here, this is the umbilical region. In the umbilical region, you'd be able to see the small intestine and the transverse colon. Here, this would be your left lumbar. You'd see the descending colon and part of the large intestine, also the small intestine. Here, the left iliac in this area, you'd see the initial part of the sigmoid colon and the large intestine. Here, this would be the hypogastric. Here you'd find the urinary bladder, small intestine, and also male and female reproductive organs. In this area here, it's called the right iliac. In this area, you find the cecum and the appendix. Thank you.